Hello, David Slepak here, the Chief Marketing Officer at Stentam, and thank you so much for joining us on Pivot Point today. I'm joined by Jim Campbell. Jim is the CEO and President of AXIM, a full-service third-party administrator with some very, very unique capabilities in sponsoring healthcare plans for those employers in the government contracting space. So, Jim, thank you so much for joining us.
Appreciate you having me.
We share a common passion for kind of solving this country's healthcare challenges and issues, and super excited to have you on the podcast today. So, take a few minutes and give us a little bit of your background and how you got to where you're at today.
Yeah, well, that's a funny story. So, I was an infantry Marine that got out of the Marine Corps due to injury and fell into healthcare. So figure that out. You're not going to be able to. But long road short, carrier based, moved to the Metro DC area, supporting brokers and the small group market, which that carrier didn't have an experience before. And every company, or almost every company, is touching government contracting. So I decided, wow, these guys and gals are all making a boatload of money. I'm going to try to get into brokerage, and did that 2005. And, fast forward, you see all these companies touching GovCon, 80+%, and you become very adept at just saying, well, I'm going to focus on this type of business. Dig a little bit deeper, and there's many strata to government contracting. And these are private entities. These are private companies doing work for the federal government. All agencies, all types of capacities, all types of work, blue, gray collar, white collar, straight blue collar. And it's a pretty fascinating business. And being right there in smack dab in the Metro DC area, you have no choice but to be a part of it.
Interesting, very interesting. So, at least the first part of this podcast today, I'd like to kind of hone in on our conversation on the government contracting space. And you mentioned these are private entities that have secured deals and contracts with government entities. Tell us a little bit about, some of the challenges that go along with that. And from what I understand, as part of the Inflation Reduction Act, there's a new round of literally trillions and trillions of dollars that are at play for businesses, small, medium, and large, to do work for our government. So, kind of give us some insight as to kind of what the space is. Perhaps some of the folks on this podcast are already in this space. Perhaps are looking to get into this space as well.
Yeah, absolutely. A lot of folks want to be in this space, from the consulting side, from the benefits delivery side, but it's very niche, as you said. The IRA is one thing, the Inflation Reduction Act, as you spoke about. Taking a step back from that, though, you come across entities that need benefits in order to attract and retain employees, like every other company. But when you're defined by a work period and a finite dollar amount, that can become very tricky. As you know, in our industry, in the benefit space, those cost swings can make or break any company. It's ever more present for a government contractor that has very strict budgets on what they can and cannot provide for. And that makes them either more or less competitive in the market. So when you're dealing with a finite amount of dollars for a finite period of time by contract, there also comes the rules and regulations set forth by the Department of Labor. It makes it very difficult for companies to be able to create budgets and standardize things in order to keep their populations growing and healthy. So what I've always set out to do, and what I maintain to do, is to find the best benefit programs for the available dollars against the eligible risk. You'll understand that more than most. But not every group is perfect for self-funding. And all of our clients nowadays all hear self-funding, everybody needs to do it. That's not a great solution if everybody in your group has a great health, but there's that one person that has a bad risk and you're a small business. So it really is trying to understand every company, what they do, who's in their population, and what dollars do they have to work with, creating the solution that can meet the demand for every single person.
So when a small business or medium-sized business or any entity is doing business for the government, It's my understanding that as part of the contract, if you will, that in many cases they have to provide certain things to their employees, fringe benefits, like David Slepak. There's all these different terminologies that I've heard get thrown around out there. Can it help us understand, like, I mean, gosh, I want to do business. I want to build a road, or I want to do security work, or I'm getting contracted to do whatever for the government. What are some of these regulations that are a little bit different than just your standard business operations?
100%. So I talked about that levels, the strata underneath contracting. First, Service Contract Act. It applies to all services that are not IT, administration, or construction. So you can think of security guards, you can think of maintenance companies, so on and so forth, facilities maintenance companies. They're subjected to Service Contract Act. That is a defined amount of money by hour worked for every employee. You have a high and a low fringe. The low fringe requires that you abide by Executive Order 13706, which is 56 mandated hours of sick leave or sick pay. And the high fringe doesn't have Executive Order 13706 in it. Both of them absolutely are built for the employee-only benefits. Well, people need to cover their families. And another reason you have to keep benefits very inexpensive or very in line with expenses. And then you have the Davis-Bacon Act. Blue, gray collar, anything that's new construction, highways, bridges, roads, you name it, airports, runways. Everything that applies to the Inflation Reduction Act, and as far as construction, is all DBA. The government just released, or the DOL just released, the DBRA, which is Davis-Bacon related acts, modifications as of October last year. And that is now clearly defining how people have to go about providing these prevailing wage to benefit and or cash. You can do either or. But if you're over 50 employees, you still have ACA requirements and things like that. And then you have ATSA and you have the IT groups. No associated acts, very tough pool of people to service because they are white collar. They are making more money. They aren't as defined by their budgets, but also very expensive and used to very rich benefits. With all of the adjustments that are happening on the benefit side, the GLP-1s, for example, or the inclusion of different types of procedures, employers, regardless of what type in government contracting, are trying to figure out how they make it equitable and affordable within their defined budgets.
So it seems like there's a ton of kind of complexity and competing things happening here. So, I mean, as any business owner, recruiting and retaining employees is paramount, right? And we know, and you and I agree, we've talked about this lots of times, benefits, right? Health insurance, healthcare is a great way to recruit and retain those folks. So I get that piece. I'm also hearing that to do business, either as a service contractor or to build new things, that not only does a business have to pay a hourly wage, right, to the employee, but now they're required to spend additional dollars as part of the benefits package, if you will, on either cash or retirement maybe, or health insurance, et cetera, et cetera. So that's kind of another complexity. And then overlay that with the ACA, right, which is, fundamentally for those employers over 50, they have to provide as part of the shared responsibility, or they're fined, right, by the IRS. They haven't played ball. So there's a lot of regulation and things. At the end of the day, it seems to be pretty profitable to do business with the government, right? But you need to kind of be thoughtful as to what benefits you're providing to be competitive. Would that be a fair assessment?
100%.
Yeah.
And I think the other thing too is I'm not an attorney. I'm not an ERISA attorney, but a lot of ERISA attorneys that focus in government contracting will tell you first and foremost, get your benefits in line, let us review them, make sure that they're falling in line with not only compliance, but then you have all the related acts. And we tell people all the time, don't take our word for it. Find a really good ERISA attorney. If you can't, we'll introduce you to a number of them that we have across the country. But there are a lot of nuances to this. And if you screw up one, you're screwing up all of them, it seems, right? Like the fines and penalties can just kind of trickle down. So we want to make sure people don't have any of those infractions or liabilities.
Sounds like quite a bit of hoops, but some great rewards, right? At the end of the day, and that the dollars at play. Obviously, our government is spending a lot of money in this space, and to have an organization engage seems smart, but you need to do it in the right way, right?
The United States government's the largest corporation in the world, right? By a
Fair
lot.
enough.
And the regulations that they put forward, especially when it comes to IRS and DOL, the idea is how are we protecting the employees? Period. Right. And making sure that the rich don't just keep getting richer and people getting their benefits and, people aren't just lining their pockets with all this government money. On the other side of that, though, employers have to stay steadfast and stay in business, and they can't just wantonly throw dollar after dollar because it doesn't exist. They won't stay in business. So there is a fine line of measuring compliance versus equitable solutions within the benefit structure. And that's where we want to have the rubber meet the road. That's where AXIM wants to be the convergence. We want to be that bridge. I always want to be able to sit aside from a CFO at a contractor and their broker and say, here's what they're saying, here's what they need. Here's what they're saying, here's what they need, and create that bridge, that conduit. And we've gotten there to a certain extent. We have a long road to go, and there's a lot of opportunity. But as you said, there's so many trillions of dollars being pushed into the space. There's so many new companies coming into this that have never ventured down this road before. We want to make sure that they don't step on any of the landmines out there.
Yeah, that makes a lot of sense. Well, let's switch gears for a minute, and talk a little bit more about kind of the healthcare and health insurance side of the business, and fundamentally, obviously, whether you're a government contractor or just a privately held organization. The rising cost of healthcare is dramatic, and employers continue to struggle to provide benefits for their employees. Employees continue to struggle to pay for the premiums, take care of their families, meet those rising deductibles, and this and that. And I know you've spent a lot of time and effort and, quite frankly, money on the technology side of healthcare, and making things seamless for employers, employees, and really kind of controlling costs. So take some time and kind of explain some of the things that you've found have been very useful that you've invested in from a technology and cost containment perspective.
Absolutely. I appreciate that. I mean, we both know that there are so many smart, honest people out there trying to fix this healthcare thing, but they're also trying to make money, right? Private equity is not stupid. They stay in this space. They're investing. And when people have to make money and be altruistic, it's a tough mix. So what we've tried to do is wash out all the crap. Pure candor here. Who's doing the right work? Meaning, is it a direct contracting facility? Is it getting your lab works done on a defined basis, defined cost? What works best in a solution? We don't know that answer. We rely on really smart people to kind of come with us for the road and build what's right for that client. There's no box that we say is perfect. What we found that works, direct contracting has really saved a lot of people a lot of money and provided a lot of resource to people that can't see providers, especially in these like service deserts, places where it's really tough to have providers or hospitals built up. It's been a godsend.
So on the direct contracting side, let's flush that out because I get really excited about cutting out the middleman.
Yep.
Right. So, when you're working with a direct contract and, by definition, you're working with a employer, right, to provide a benefit to their employees, and a provider that's going to bill them at a direct rate, obviously cutting out the middleman. What's the middleman? A PPO network, right? Potentially some sort of aggregated HMO, et cetera, et cetera. Is that kind of where you're seeing some great gains in your business?
That's where it started. And then you get to the really smart people, like, people doing imaging, people doing, directed surgeries, right? They're saying, why go to a hospital? We own the facility. We're the providers doing the work. And we can cut out, like you said, the middleman and these excess charges. And a lot of people in the audience that will listen to you or I, we know them. They understand what we're talking about. But the people that don't understand, when you go to a hospital, you have the charge master. And we've seen costs go anywhere between 300 and 800% of Medicare standard rates for one stay. We have clients that we'll do bill adjudication for. They got billed $88 for 2 aspirin. Just a couple months ago, we saw this. And when you go back and say, why is this $88? Oh, it was an error. Yeah, was it? You do that 1,000 times a month. It's not an error. Right?
It's chronic at that point.
Exactly. And this is the problem with the healthcare system. Healthcare is not as expensive as health insurance makes it. And that's my issue. So understanding that not everyone can self-fund and not everybody's in perfect condition, and the PBMs will continue to roll out the latest and greatest drugs at the highest cost, and the hospital services will charge for services being what it would be, what they need it to be. We said, who are the providers out there that are providing those same services for the same types of things in the same manner, just at a lower rate, at a more consistent delivery mechanism, right? If you can pay a provider in your small town on a direct contract to see you and your family for a visit, and the employer says, if I pay that guy directly or that gal directly, it's $50. But if they charge it to my insurance, which I'm also paying for, it's $250. I'd choose him spending 18 to 20 minutes with my employee versus 3 minutes and paying 5 times more. That's where direct contracting is just absolutely knocked the cover off the ball. And what we want to do is do more of that, expand that performance, expand that access, and then the related services, imaging, dedicated surgery services, those types of things.
Significant amount of savings. And I understand your platform and your services kind of make it easy for an employer to engage in that type of payment methodology, right? And obviously, making things simple for employer. No employer, no businessman, no entrepreneur that I've ever talked to in the 20 years I've been doing this has said, man, I love being in the health insurance business as part of my business, right?
100%.
Like I'm a manufacturer, I'm a motorcycle dealer, I'm a software, creator, I do app stores, or, I run a sanitation business, but I also have to manage this health insurance thing.
Yeah.
No one really wants to be in that. Like no
100%.
one wants that. So making things simple and easy is so critical, because as a business owner, I want to focus on running my business, not, the business of benefits and health insurance and this and that. At the same time, I have yet to talk to a CFO or business owner that says, the healthcare spend is 10th line item on their P&L. It's probably the second or third line on their P&L, right? So you have this competing thing. You have this massive expense, but at the same time, you have someone that really doesn't want to be engaged. And I think, let's talk a little bit about that, what you see with your clients, what you see in the marketplace. There's this almost like complacentness of business owners, not really by choice, but just by circumstance, that it's their biggest expense, but they have no control over it.
100%. Yeah, it's so frustrating, because I noticed across the country years ago, there's a terminology in government contracting. It was called LPTA, low price technically acceptable. It was really big during President Obama's second term. And that is literally taking the lowest bid, and the work might meet a standard. It was massive. Well, it was driving quality way down. So then the government had to it wasn't getting delivered. They had to reacquisition the work to somebody that was going to do it right. Of course, it's going to cost more money. Well, the taxpayer pays for that. The same thing happens in healthcare. If you have a really inflated cost of a service, but you don't know the quality you're getting, you're probably going to have to do it again. It's going to cost you more time, expense, pain, whatever. So what we found is creating cost and quality measures for an employee and their family to get the right answers for them, and not to panic, and not just to say, I want to go to the latest and greatest or the most expensive provider. Truly understanding what that impact means to them has created a world of difference in the return that they get. And government contracting for me was that shining light. because our clients, those CFOs, those COOs, CEOs, had to look down and say, this thing is killing us. This second line item on our budget sheet here is actually outpacing anything we'll ever make in profit. And we're on a 5-year contract with this thing, right? So I said, wow, the way that contractors have to monitor their budget and manage and guide to, every client should look at that same opportunity in their benefits by employee. Empower the employee to make those decisions. Empower the employee to see what is best for them and their families at what prices. And when you do that, better decisions happen. So what we're seeing is like this past year, I can't tell you we've not had one client take an increase. And I'd say the highest one was 4% in the self-funded market. 4%.
Remarkable.
And that's unheard of, right? Getting money back in a level funded solution where just a year ago you were paying $200,000 or more for premiums. Now you're getting $100,000 back going towards your next year's premiums. These companies, they absolutely need it. The employees need it. They deserve it. So how do we take them the tools to see that return year over year?
That concept of surplus return, it's funny, as an agent, as a broker, and as a consultant, right? Our job is to kind of share the entire, stratosphere of different options, right, for an employer. Not just a one-size-fits-all, whether it be a fully insured Blue Cross plan or a level-funded, whatever plan, reference-based pricing, value adds, those types of things, right? So we look at the whole spectrum. And when you talk to an employer and you kind of shed light on, well, this is what you were seeing over the last 10 years, or this is what but there's this whole other sector of opportunities out here in healthcare plans that make sense. And some of them include a surplus return. And they're like, a surplus return? What's that? It's like, well, those are your premium dollars that you're spending. If you don't spend them, you get them back. What? What are you talking about? Like, it's like some new thing that people don't understand, or that their current broker or consultant haven't told them about.
Yep.
And I think it's empowering, right, for a business owner to say, hey, look, at the end of this period of insurance, those are your dollars. You can get them back, and making sure that every business owner, now granted, level funded or partially self-funded or self-funded plans, as you point out, don't make sense for everybody, right? If you have an older or sicker population, or whatever the circumstances might be, it might not be the right solution for them. But it's interesting, and I want to kind of circle back on something you brought up, which I think is a very important concept of kind of where you've gotten in your space today. So you have this fixed contract for 5 years, right? And you can't go back to the government and say, well, I need to charge more money now. Mm-hmm. So you have this fixed income, but then you have this extreme variable cost of kind of like an unknown of health insurance and healthcare benefits, which, from year to year, you could get a 10% renewal. You could get a 15%. I mean, I've seen companies get a 25% renewal. So their cost increases, but they can't go back and be like, well, sorry, my health insurance increased, so I need to charge you more, government, to build this road. So I think, talk to me a little bit about that. I mean, that's a huge light bulb in my brain to say, gosh, you really understand that this is a big deal. You can't just start charging more money.
Yeah, and this is what I think is great about the most recent changes in our industry. The CAA, the NSA, a year and a half ago, making sure that people now disclose their compensation, making sure that there aren't nefarious actors out there bundling extra comp and doing these things, and making it fully aware or relevant to that employer. It's like, well, I like you, but I don't like you this much, right? I don't like you enough to get a 25% increase, which means you're getting a pay increase. And it really has now put everything on par to where the experience I come from, it's a defined amount. Do a job for this much, and whatever your profit is in there, that's great, but you're not getting any more money. I say the same thing in our relationship to our clients. Our fee is our fee. You're paying me to do a job, whether that's benefit advisory, whether it's compliance, whether it's use our system, whatever it is. If I lose the boat, that's not your problem. I'm not asking you for more money. We said up front that this is going to cost X. My job is to perform. And if you get a return, I want to share in that with you. I'm going to bet on myself and our due diligence to, see if we can come out ahead. Cool thing about our industry now is in the last, I'd say, 7 or 8 years, we've seen population health management really take off. You've got the great companies out there, the Springbucks and all the other companies, and they've done a great job. Fast forward with AI generation and some LLPs or LLMs. The machine learning has gotten so much better to risk quantification. Now you can take the data by company, by employee, back to the owners of that, who should have it. Empowering the employee, saying, "Oh my God, I've got some conditions I have to worry about, and I don't know how I'm going to pay for it. Thank God I have this health plan." Or I'm going to go somewhere that has a really good health plan. Or that employer says, "Oh, we've got some conditions in here, and I like you a lot, but I don't know if self-funding's for us because I can't take on that financial burden." You're opening up the model because you're opening up people's eyes. And that's what's great. I love what's happening in the industry now.
So data has become, a big part of your business, right? And in multiple levels, right? And as I think about kind of where data is extremely useful, so obviously underwriting the risk of a group, and for employers, right? I mean, that data is pretty valuable, and if they have a pretty healthy younger population, they can take advantage of that data and potentially pay lower premiums for the insurance, right? Conversely, once you get the plan, now collecting the data of what's happening with those employees makes a lot of sense as well to understand, like, gosh, we have a lot of people that are on opioids, and well, what's the cause of that? Well, they have, musculoskeletal issues, or, what are the things that's causing that, 20% of the folks to cause, 80% of the dollars being spent, and then potentially address it. Is it a provider thing? Is it a work environment thing? Is it just a whatever those things might be? And then on your platform, using some of the tools that you put into the healthcare plans that you build, you can now control that cost, right? Which I think is really cool.
To some degree. I mean, the large companies, if you look at it in Amazon or a Boeing or somebody that's huge, right? Mm-hmm. They've been doing this for years. They've had risk managers by division that have been doing this stuff for years. But being able to take that coordinated data down to a small employer that doesn't have that ability or that budget is critical. They're still the same human being. Why should somebody get a better advantage from a cost containment strategy because they work at a large company versus a company they might love that's just smaller and they don't have the budget? We've opened up the door now to give everybody that equal opportunity to understand from an employer budget side and care side to an employee utilization and care side that and financial management side that we've never had a chance to do before.
Yeah, that's music to our ears. One of the things that I talk about that's really important here at Stentam is bringing kind of those enterprise level solutions, the Walmarts and the Amazons and the Googles, right? Enterprise level. I mean, they have those resources. Yep. But bringing those types of thought processes, tools, data, access to those things down to small and mid-sized organizations where, you don't have to be, a Fortune 5 company to offer and do these things now. And it's great, to work with folks like yourself and your organization that has a similar mindset.
The one thing I have consternation about is that these companies, people don't realize, the Googles, the Amazons, the Walmarts, all those companies, they don't live in a 12-month renewal cycle. They manage this every single day. There is no renewal period. There's open enrollment. Of course, they want to get people signed up and get everything listed. These people work every single day at their job to manage the risk. Unfortunately, in the brokerage community and the risk management community, we've gotten into this 12-month cycle. People don't talk to their brokers until 60 days before their renewal or whatever it is. There's a critical issue with a claim. That's our problem as an industry. As an industry, we have to get better at being who we say we're going to be, myself included. AXIM has had our pitfalls over the last decade plus, building this technology, stepped on every landmine there is, right? and still not getting it all 100% figured out. The difference is I own this stuff. I can make the change. I don't have to point a finger at somebody and say, well, it's on you to pick the right vendors. That's our job. So what we want to do is work with really smart consultants, really conscientious employers, and really inquisitive employees and say, like, make this thing better for us because we're going to turn around and make it better for you. So that feedback is critical, and understanding this is no longer a 12-month cycle. We're going to do it every day.
That makes a lot of sense, and kind of reframing kind of the thought processes around, it's an ongoing process, right? The other thing I always like to say is, this is a team sport.
100%. That's the truth.
And you mentioned all the people, right? Having your consultant aligned, having the employer on the same page and aligned,
Yep.
Having the employee aligned even here within our organization. I serve as an advisor and consultant for our healthcare solutions, for us. And, look, like, everybody's spending the money smartly is really important. Leveraging telemedicine, leveraging patient assistance programs or things that you qualify on pharmacy. It's a team sport because everybody the money's coming out of the same pool, right?
Yep.
And if you're responsible, no different than you're the purchasing manager in IT and you're buying computers or you're buying paper clips or whatever it might be. The expectation and even your fiduciary responsibility is to get the best deal, right? And the best value on those services. And healthcare shouldn't be any different. What I pay for a colonoscopy or a prescription drug, I should have the same mindset because I'm spending the company dollars as buying the new computer or the new microphone or whatever it might be. So it's fun to kind of think about, but even more important to execute.
I not to cut you off, but I say all the time, people in our society now will automatically go and invest more time in buying the latest, greatest pair of jeans than they do their own care. That's disturbing, right? Because it's like, oh, it's not my money. It will become your money. It will absolutely impact you one way or another, either in your paycheck, in reductions in bonuses, more out-of-pocket expenses because they had to increase the deductibles or your out-of-pocket exposure on your health plan. It will impact you. And we've gotten so ignorant in this country. We've gotten so safe. There's no savings anymore. People don't have the money to take care of themselves or their families should something happen. That's deplorable.
Yeah.
And what I've found is in the small business world, especially, we're trying to keep up with the pace of the Fortune 5s, right? And the machines and the AI. It's impossible. And it's all pushed down to an HR person. So if you think about this team sport mentality, companies hire a benefits advisor like they hire an attorney. I need you to protect me. Protect me. Do what I need you to do. Fill me in, help me support the company. The employees are not being engaged in the same regard because HR is running 9 different things. Who's on their team helping them? Right? And this is where I think the advisory brokerage community, service providers, we all need to change. I believe this. You can say I'm yay or nay on this in the future, but I think our industry is going to, shrink somewhat. We're going to get rid of every salesperson, and we're going to start to show real value for what it needs to be, and the cream's going to rise to the top. Well past time for that. But I think we're going to see this reckoning come pretty soon to our industry.
Yeah, I agree. I think kind of refocusing our efforts and honing in on doing the right thing, right, for the right reasons,
Yep.
For the right people. Well, Jim, thank you so much for spending some time with us today on Pivot Point. Super insightful. I welcome, all of the thought processes and really some of these niche areas, right? I mean, we're in the specialty tax. We see all sorts of different employer groups out there, and obviously we're able to deliver some benefit solutions to them as well. Any kind of parting words or thoughts as we kind of wrap up this afternoon?
I would just say that, thank you, first and foremost. We go back now, right? We've seen a couple different matriculations of this thing as we've been working together and been friends. one thing I think that's really important that I'd like to impart is that folks like us in our business, be prepared, because everybody's a fiduciary now. You make recommendations, you help somebody, you push an employer one way or another. Become very smart, because right now the wave of compliance is really starting to hit everybody in our industry. Things that I've had to deal with for over a decade, and it's now becoming very, very prominent in our industry. So I just want people to stay aware. If I can help in any regard, questions, comments, introductions to the right attorneys or investigators, whatever, I'm happy to do that.
Awesome. Well, thank you so much. And again, thank you for tuning into our podcast today. Stay tuned for another episode next week.
Thanks, man.